Hmm.
So it could be something as, our adherence rate is really low because maybe in the first 30 days, there's really difficult side effects.
Hmm.
And so patients are like, you know what, maybe it's not worth it. So how do we manage a patient through that difficult onboarding, right? So it could be side effects. It could just be an understanding of why I'm taking this
Yeah.
medication. Some diseases are what we call sort of silent.
Hmm.
Patients don't really feel bad. And so, they have to understand why they're even taking this medication. As I said, some are dealing with side effects. Other medications that we work with, sometimes there's no efficacy for sometimes even the first 3 or 4 months.
Hmm.
So a patient's thinking, oh, I'm taking this medication and I don't feel any better. I don't feel any different. Why should I keep doing it?
Yeah.
So how do we handhold them through that process till they actually do see the efficacy of the drug?
Yeah.
So it's really important for me and our team at Medisafe to really understand that patient journey, understand maybe some of the challenges or opportunities of that drug. And so we can really design and create a solution that's going to get patients to be successful.
Hello, everyone, and welcome to the Business of Learning podcast. My guest here today is Stacey Wasserman. She is the Chief Commercial Officer at Medisafe. My name is Joao Camargo. I am your host. And Stacey, thank you so much for being here today. I'm excited to have this conversation.
Thank you. I'm excited as well.
Well, why don't we start off with you just telling everyone a little bit more about yourself and obviously about your role at Medisafe, who you guys are, who you help, and any context you'd like to share about the business.
Sure. Well, again, thanks for having me. As you said, my name is Stacey Wasserman. I'm the Chief Commercial Officer for Medisafe. Been with Medisafe for about 2.5 years. Um, my background is in healthcare and life sciences. I've been working with pharma customers for most of my career. It spanned everything from data and analytics
Mm-hmm.
to AI and machine learning, genomics. And the last several years I've spent in the digital health space. Previously working as the chief revenue officer for a company called Bright Insight. And then, as I mentioned, 2.5 years ago, joining Medisafe.
Mm-hmm.
So Medisafe is in the, as I said, digital health space for life sciences. Really, our mission is to empower patients to live better, healthier lives through the use of technology.
Mm.
So at the core, we are a medication management platform, which really allows patients to holistically manage their healthcare, everything from the medications they're taking to supplements they're taking, but also their doctor's appointments, their
Mm.
lab visits, as well as keep track of their health. So patients track things like sleep, mood, pain, their weight. As we think about GLP-1s are in the news every day,
Yeah.
we have a lot of patients tracking their weight, but you can track over 100 different health conditions on Medisafe. And so by offering patients this holistic experience, which we also hyper personalize through the
Mm.
use of AI and other models, we really engage patients to take control of their health and be more successful on therapy.
That's awesome. It sounds like it really allows them to have that full clarity and that roadmap of exactly what's going on, but also what they have to do. Is that correct?
Absolutely. Patients start out with their daily calendar, so they know everything that's on their to-do list for the day when it comes to their healthcare. But it also allows them to communicate with patient support services at a pharma company or their healthcare provider, or even involve a family member. We have something called a med friend,
Mm.
which can be a caregiver, but it also could be just a friend, a spouse, a child who's involved in your healthcare and make sure that you stay on track.
That's awesome. And it sounds like there's a lot of that AI component of it, which is nowadays awesome to hear because it creates so much facility for these people to have the care that is specific to them. Is there also an aspect of one-on-one care? How does that side of things work as well?
So really for us, we're really sort of mission driven on engaging patients,
Hmm.
right? So our goal is to keep them successful. And one of the ways we do that is by creating a very hyper personalized experience. So you and I could be on the same medication, have the same condition, and yet be very different places in our journey,
For sure.
right? You may be newly diagnosed. So there's a lot to learn about your condition, different treatments, even the treatment that your doctor's prescribed. And so the content that we're going to put in front of you is really going to be very focused on your needs at that time. However, I may be in therapy for a year already
Hmm.
and have very different needs. I may be dealing with affordability challenges, right? How do I pay for my medication? Or I may be dealing with multiple medications and really want to understand how to use those medications concurrently.
Hmm.
So through Medisafe, you and I will have a very different experience. So the content that's put in front of us may be very different.
Yeah.
And also the way that we communicate might be very different. You know,
Hmm.
we offer an omni-channel experience. So we have an app, but we can also do web and chat and text and
Mm.
email and voice agents. And
Yeah.
so you and I may communicate differently, and I or you may communicate differently throughout parts in our journey. So, right now I may be very comfortable with getting text messages, reminders about my medication, reminders about my refills, but maybe something changes and I need a richer, fuller experience. So at that point, I may want to go to the app, which is going to provide me with a lot more content and a lot more resources to help me be successful.
Mm-hmm.
And so we want to offer patients what they need at that time and communicate with them in the way that makes the most sense.
I like that. I really like the omnipresence type of thing as well because I think so often now, hey, I'm not checking email, or I'm not checking text, and then so many platforms either one or the other, and then there's nothing that you can do about it in the in between. But with you, it sounds like there is that choice. People can choose the level of notifications or whatever it might be that they get, but also the personalization in whatever type of platform that they choose as well, which is pretty awesome. Do you? Sorry, go ahead. Do you want to add anything there?
And I was going to say, so beyond even just the way we communicate,
Uh-huh.
and I told you we put different content, even the messaging that we put in front of you,
Hmm.
right? So we look at models that can look at tone, voice, cadence, time of day, best available time, because we want to communicate with you in a way that is going to get you to take that next best action. So we want to reinforce positive behaviors and ultimately change any negative behaviors that you may have so that you can be successful on therapy.
That's really, really cool. And talk to me a little bit more about some of the use cases or maybe the most common patterns that you see for patients using the platform and how much where the I don't want to say the real value because it sounds like everything is extremely extremely valuable, but maybe some of the most common patterns of people saying, "Hey, this is the part of platform that really sticks out to me because it's so helpful in XYZ parts of my life." So that's for the patient side, but also for the side of the partnerships that you guys create
Yep.
and how much it helps those companies as well.
So great question. I mean, we really have sort of two sides of our business. On the B2C side, which is, the direct to consumer, we have about close to 14 million registered users. Those patients a lot of times will write to us, send us messages that say, you've allowed me to live independently, or you've allowed me to send a kid away to college because I know that their medications are going to be monitored, or I as a parent can see what's happening. People have complicated dosing schedules, or they're taking multiple medications, all with different dosing schedules, and they have to throw in a doctor's appointment there and a lab visit there. So really, for many, many of our patients, it's just being able to kind of manage in a very busy lifestyle all the
Mhm.
different things they have to do. On the pharma side, on our B2B side of the business, it's really important for us that we kind of understand the patient journey.
Mhm.
And the way I kind of like to describe it is, what are the potential points of leakage across that journey? Like, where are we losing people? Where are patients dropping out? And honestly, for every brand, that can look very different. Some of the things we hear universally are sometimes getting patients even to that first fill,
Hmm.
right? Getting that first prescription. A lot of drugs now are in what we call specialty products. So they're not going through your neighborhood CVS, but they're going to a specialty pharmacy.
Mhm.
They need to go through a benefits verification, a prior authorization process. For a lot of patients, that's very confusing.
Yeah.
They don't understand it. And so some of them don't even ever get to that first prescription
Mhm.
because they just kind of lose interest, or they kind of just get confused and drop out. We also hear things around persistence.
Mhm.
For some drugs, it can be even getting to that first refill. For others, it may be 90-day persistence. For others, it may be
Mhm.
6-month persistence. And so we want to dig in and understand kind of what's driving that non-adherence and non-persistence.
Mhm.
So it could be something as, our adherence rate is really low because maybe in the first 30 days, there's really difficult side effects.
Hmm.
And so patients are like, you know what, maybe it's not worth it. So how do we manage a patient through that difficult onboarding, right? So it could be side effects. It could just be an understanding of why I'm taking this
Yeah.
medication. Some diseases are what we call sort of silent.
Hmm.
Patients don't really feel bad. And so, they have to understand why they're even taking this medication. As I said,
Mhm.
some are dealing with side effects. Other medications that we work with, sometimes there's no efficacy for sometimes even the first 3 or 4 months.
Hmm.
So a patient's thinking, "Oh, I'm taking this medication and I don't feel any better. I don't feel any different. Why should I keep doing it?"
Yeah.
So how do we kind of handhold them through that process till they actually do see the efficacy of the drug?
Yeah.
So it's really important for me and our team
Mhm.
at Medisafe to really understand that patient journey, understand maybe some of the challenges or opportunities of that drug. And so we can really design and create a solution that's going to get patients to be successful.
That's awesome. It's like creating that frictionless environment for them to really be able to go through that journey, like without the bumps in the road and having to step over the rocks and everything else.
Yeah, Joe, you said one of my favorite words, friction, right? Because we can throw what we call fuel, a lot of fuel at something, right?
Yeah.
Keep giving you more information or, better pricing, whatever it is. But
Hmm.
until we understand the friction,
Hmm.
what's stopping somebody from doing something, it's really hard because you could be throwing more and more at it and hitting a brick wall,
Yeah, exactly.
right? We need to understand the friction. What causes somebody to not do something,
Hmm.
right?
Yeah.
And once we can sort of diagnose that friction, then we can hopefully solve for that.
That's awesome. And what you just shared actually reminded me of a story when I was back in high school. I had terrible, terrible acne, and Accutane was a huge help for me. But Accutane is one of those things where I didn't know at the time, but it gets so much worse before it gets better. So my face was already like a red pepperoni pizza. But it started getting worse in the first like 1, 2, 3 months, and I was like, this is just making things worse. And then by the fourth month, complete switch.
Right.
But if I didn't understand that that was just part of the journey, I would have completely been like, oh, I'm not even gonna do this anymore. And then my face would probably still be a pepperoni 10 years later. So I'm glad that that didn't happen.
Great example. And so it's important that we provide patients with all the tools and
Mhm.
resources to be successful, whether it's understanding the treatment, efficacy, whether it's helping them pay for the drug, other ways to better afford that drug. You know, we can offer like a digital copay card. If the
Mhm.
pharma company offers a copay program, let's make that accessible through Medisafe so patients know it's there and know how to use it.
Mhm.
We can connect patients to a pharma's patient support program or patient support team, human care team. So even though we're a digital first company, we can actually facilitate and create
Mhm.
efficiencies even in connecting with a human support team as well.
Yeah, for sure. That's really, really awesome. And I would love to ask a little bit more now, when it comes to the relationships that you're creating with a lot of these companies, because I think healthcare is one of the industries where I don't want to say they're held back in time, but they kind of are because there's so much hesitancy into adapting to new technology and AI and all these things. So how challenging do you find to educate possible customers into the help that you can bring them and really show the value in what you guys are doing, as opposed to, hey, just trust AI and hop on board, where so many of these
Right.
older companies are just not willing to hop
Well,
on.
no, but highly regulated, right?
Okay, yeah, that's
They
part
work
of it as well.
in a
Yeah.
highly regulated environment, right? So there's a lot of rules, right?
Hmm.
Obviously, when we're dealing with patient safety, um, and patient health, there's a lot of rules, regulations, because ultimately we have to care about the patient
Of
first.
course.
So, I often say that a lot of my customers want to be innovative as long as 5 other people have done it and proven it works, right? So it's innovation with a twist. So for us, it's really important that we have the proof points,
Hmm.
right? So the value proposition that we offer our customers is that by keeping patients adherent and more persistent to therapy, the drug is actually going to perform better. It's going to work.
Hmm.
And when the drug works, patients stay on it, doctors are happy, everyone's happy. Um, but what we've been able to prove is that a Medisafe patient will have better adherence and better persistence than a patient not on Medisafe.
Hmm.
And so, I often say there are a lot of companies out there that can build you a solution, a digital solution, right?
Yeah.
There are a lot of companies that can even build it and launch it into the market and get patients to try it. But what we've done is taken it that extra mile, or I should say that last mile problem to show the value, the proven solution.
Hmm.
And so what we've been able to do is kind of create case and control,
Hmm.
right? So take a cohort of patients using Medisafe and then create a matched control that look just like them, but are not on Medisafe. And
Hmm.
we do that using third-party claims data. And what we do then is we compare the two groups, right?
Hmm.
We compare those two cohorts. So now I have two cohorts that look very similar: age, gender, the disease, the initiation date, as many variables as we can to really make sure that we have two cohorts that look very similar.
Uh-huh.
And then we look at things like their adherence and their persistence. And we see that the Medisafe patients actually have better adherence and persistence than that control group that looks just like them, but not using a Medisafe.
Mm. Very interesting.
And so I think, for me, working with pharma partners, reaching out to them, being able to sell or partner on those proof points is very impactful.
Oh, that's awesome. And it sounds like that is able to create then that trust that they're looking for. Like, hey, show me the proof, show me the 5 people, show the other use cases to really allow them to see how it can benefit them.
Absolutely. So proof points, and look, we have great client references too, right?
Yeah, that's always nice.
Would you like to speak to a customer? Because our customers really do love working with us. And I mean, they love the results, right? I often tell them we're in the business of making heroes,
Mm.
and nothing makes me happier than being able to work with a customer. They've made a decision to work with us, and for them to be able to turn around to their organization and say, "Look what a great decision I made."
Yeah.
Choosing Medisafe and working with Medisafe because we created this great solution, we launched it into the market, we have all these patients on it, and look at the improvements and outcomes that we're seeing.
That's really, really cool. And how are most of these companies usually finding out about you guys? This is word of mouth, referrals. What is that process for them to come in and say, hey, I want to possibly have a conversation about this?
Yeah. So look, we've been in business for 13 years now. As I said, we have close to 14 million registered users on the platform. I'm a big lover of AI and things like ChatGPT.
Sure.
And I think some people find us in ways like that. I used to say Google. They would Google medication management or medication adherence. If you ask ChatGPT, what is the best medication management platform on the market, you'll hear about Medisafe. On top of that, obviously, we do our own, sales and marketing. We have a team of marketing professionals who are out there, getting us out on LinkedIn, getting us out on social media. I have a sales team who, really understands what makes the ideal customer for us and is doing, reaching out and prospecting on those as well. And what's really satisfying for me is, we may have a customer and, in this day and age, people switch jobs, switch companies fairly often. It's so rewarding for me to see somebody leave a company where we have a partnership to a new company, and one of their first calls is to us because they want to work with us again.
That's awesome. Yeah, I think that's always the nicest piece of this the nicest bit of reminder that we can get of like, hey, the job that we did with XYZ person was so good that now they're at ABC and they still want to be associated with us, work with us, and do all the things that we did for them there because it's going to be just as helpful.
Exactly. So that's great, when we see people switch companies. And I also, for me, it's rewarding when we're doing a really successful program within one therapeutic area, one disease area, and they recommend us to other disease areas. In a pharma company, the neurology team and the immunology team and the oncology team might have very little overlap. So we really rely on our customers to help us navigate the organization as well.
Awesome. Very, very cool. Stacey, I would love to ask, in your entire journey of business, your career, many roles, many different companies you've worked in, what are some pieces of advice or things that you've heard from either a mentor or from a lesson that you learned from a specific challenge that you went through, whatever it might be, that really stick with you, that you take together with you when approaching a new situation, trying to handle a new problem, a new difficulty, a new challenge?
I would say one of the things I think about a lot, and it's not just in business, it's in life as well, is, I was always taught, or we're always taught, like the golden rule is treat people the way you want to be treated. And what I've learned in my life is that that is really not true. You have to treat people the way they want to be treated. And so what works for me may not work for you, right? And so it works in relationships, both personal and business, whether it's working with my internal team. My internal team, everyone on my team is motivated very differently, and I have to learn what motivates them. But I see that with customers also. And so sort of translating that into business, I always say we can't sell the way we want to sell. We have to sell the way our customer wants to buy.
Yeah.
Right.
100%.
And so I think these things are all kind of related, that we really have to understand who we're working with and really appreciate that there are differences in either the way people buy or the way people receive information or the way people are motivated, and really treat them the way they want to be treated. This is what worked for me.
Yeah.
I may be very different than my customer in what I appreciate and how I like to be, communicated with, just similarly to what we talked about with our patients, have all different communication styles and challenges. And so I really think undoing that, treat people the way you want to be treated, is undoing that myth is a great lesson.
Interesting. Yeah. Cause then it's about having the eyes and ears to really understand what they value and what's important to them. And it's like there is a good intention in treat others in the way that would want to be treated, but the outcome is kind of can get shifted when it comes to a lot of situations. That's awesome. I love that.
Right. It is. It's nuanced, right? Like,
Yeah.
I'm kind of making a little bit of a joke because
No, of course, it's all good.
right? It's like treat people the way you want to be treated. But it really has been impactful for me, even like when I work with my own team,
Mm,
you know, and I talk to other leaders and other people in other businesses. I have a friend who tells a story about um, she runs a school and she was giving her teachers small gifts all the time,
mm,
thinking that it would motivate them. And she was realizing that it really wasn't moving the needle at all.
uh-huh.
And when she kind of sort of dissected it a little bit, she realized that that was not what motivated them. So she changed sort of courses and she invited them all to her home for dinner.
Mm,
And the impact of that, she realized, was for her teachers was really more about quality time and spending that time with them and getting to know them was really much more impactful than giving them, Dunkin' Donut gift cards or
yeah.
Amazon gift cards. It just wasn't how they were motivated. And it was like a big lesson for her. And she taught it to me,
Yeah.
realizing that we really have to figure out what motivates people if we want to really get to know them and have a successful relationship, whether it's personal or business.
Yeah, tailored to them. That's awesome. I like that. I have two final questions here for you, Stacey. One is a question that I've been asking everybody on the podcast, so it's kind of become a frame of the show. So I'll start with that one, uh,
Okay.
which is this: let's say you had a magic wand, an amazing wand that you could just wave, and it can solve one thing in the business. There's oftentimes many priorities and many things we're trying to solve and get done, but just one thing, a challenge, an obstacle, whatever it might be, that would allow you to solve that challenge that then leads to the growth, the targets, the goals that you guys have for the company. What's the one thing that you would like to wave that wand and solve?
If I could wave my magic wand, um, we built fabulous programs. And for patients who join the programs, they see great success and better outcomes. Better clinical outcomes. Our partners see better economic outcomes because we're able to keep people on therapy, which grows revenue and business. I'd like to wave a magic wand and be able to um, find those patients and enroll them immediately. I'd love to have a way to be able to get out there in front of all these patients and be able to get them onto the program successfully and easily.
Mm.
Um, I also often say pharma has all these amazing programs, and only a very small percentage of people even know about them or find out about them. And they're these wonderful programs. So if I could wave my magic wand, I'd be able to reach out to every patient in the world and grab them and show them what we're doing.
Awesome. Good stuff. I like that. And then final question here for you, Stacey. It's actually not a question from me. It's a question from our last guest to you. And they had no idea who you were. All right.
Okay,
Are you ready for the question?
I'm ready.
This is a deep one. So here it is. What's the thing that matters to you more than anything else?
What's the thing that matters more to me than anything else? Um, I think it's being true to myself.
Hmm. Authenticity.
Authenticity. I think it just, again, we talked a lot about, both your personal life and your professional life. I think that's another one that carries over. I want to be authentic. I want to be true. I want to be a true friend, a true partner, a true family member, a true business partner. I want to know that when people are in a relationship with me, that they can trust me and they're always getting the real thing.
That's awesome. I love that. And we don't have time to go into this, but I'll mention something very quickly to you. If you're not familiar with a study called the Spain study, not the Spain, the country, Spane, are you familiar with that?
I am not.
I would definitely check that out. It is a study on frequencies, and authenticity is a big part of that study when it comes to the results. I would butcher the explanation here because we don't have that much time, but for I've mentioned it in some other episodes again as well, because authenticity is always a recurring pattern. I think it's such a thing that people can overlook, but it is so important for us because we really are able to sense authenticity, and that study explains why we're able to sense authenticity, which is an interesting one. So it would be a cool one to check it out.
I will definitely check it out. Look, I've spent most of my career in sales,
Mhm.
and so I am my brand, right? And so I want people to know that they can trust me and that, you know, I always give them my best self.
Amazing. Stacey, thank you. Thank you so much for your time. This has been such an incredible chat. Where should people go if they want to learn a little bit more about you or maybe a little bit more about Medisafe?
Well, they certainly can find us online at medisafe.com. But I would also encourage people to go on the App Store, either Apple or Google, and download Medisafe and try it for themselves. It really is a fantastic program for themselves, for a loved one, for a parent, for a child. So it's a free app for everyone. So I encourage that. And certainly you can find me on LinkedIn at Stacey Meltzer Wasserman.
Amazing. Stacey, thank you so much for your time. For everyone else, I'll of course leave everything here down below. If you enjoyed listening to this conversation and you want to hear more conversations like this, please subscribe and I will see you on the next episode. Thank you, Stacey.
Thank you.